Well, welcome everyone. We are excited to have our monthly seminar series for the UAB CFAR Implementation Science Consultation Hub, and delighted to have Dr. Bertha Hidalgo, Associate Professor here at UAB in the School of Public Health and the Department of Epidemiology, and one of our esteemed colleagues on our team who's going to share with us using effective social media strategies for dissemination. I probably got that kind of wrong, but anyway, she's going to tell us how we can use social media to do a great job with our dissemination. So welcome, Bertha.
Thank you so much for having me today. I am a little bit hoarse because my 8-year-old had his playoff game for their rec season for baseball, and you would have thought that I was at the World Series. And so I'm my throat is suffering a little bit today.
I love it. Go, Mom. I love it.
They did lose, but he played really well, so I'm proud of him. But I can.
Of course.
So my apologies for that, but I prepared a slightly different talk than I gave last time. If you have been around for the last year or so, you may have seen a few of these slides previously. However, there is new content. I've made sure to add new content since there were going to be some familiar faces. And then what I'm really excited to share with you is an example of the way in which one of my funded studies has used social media as a dissemination research project, and even some of the data that we now have as a result of effectively implementing dissemination strategies for 3 aims of the grant. That grant is coming to a close. So I have no disclosures to share with you today. And I want to emphasize that I am focusing on dissemination specifically. We've had great people like Larry Harold, who's on the call today, Allison Varley, and others who've talked about implementation. Dissemination science is sort of like the forgotten family member of the field. I think like we tend to ignore the fact that once we've implemented, it's also really important to disseminate the strategies, figure out the communication in which we're gonna use to be able to talk to the other champions at other sites, for example, or that if you are using evidence-based strategies in order to increase, in my case, for example, awareness, education, but also as a recruitment tool for studies, that it's really important to think about the frameworks and the ways in which you can use dissemination to be able to engage target populations for the work that you're trying to do. And that really the dissemination of scientific evidence into both regular and effective use is really complex because there is just this multiplicity and lack of capacity in our systems, but also the end users. And there's such a diversity of target audiences that it's really important to be very intentional about the work that we do at the outset so that we have a plan going into the phase where we're going to be disseminating. And so before starting, what you want to ensure is that you address some of the main challenges. One is that too often we start with ineffective dissemination strategies, or we don't have a strategy at all. So we've done the implementation, and now we get to the phase where we think, okay, now how are we going to get this out to other people, or how are we going to get the information out to the populations that really need to receive this information, lay audiences, communities, etc., patient populations. The second challenge is that we don't really have a set of best practices. So I mentioned that this is sort of the forgotten, part of, we say D&I and it starts, dissemination and implementation, but we really only focus again on that implementation phase. And so what are the best practices? I don't know. This is something that I'm actively working to try and figure out if there are best practices in place that we can coalesce and be able to access as a research field. Best practices of implementation science are necessary to ensure that the systems, the implementers are there, but what happens to dissemination? We need best practices of dissemination so that we can more quickly adopt evidence-based practices and information. Okay, so when we talk about these two things, you know what implementation science means because you've listened to our talks or you're actively engaged in implementation science. But dissemination science is about studying the way in which we target the distribution of evidence-based information and intervention materials to specific public health or clinical practice audiences. So the goal here is to spread but also sustain knowledge use and evidence-based information. So this comes from HHS. The other thing that we tend to forget is that we really need to be very intentional also about how we measure knowledge transfer. It's not just enough to get the information out there or to disseminate the strategies, but that we also figure out if the strategies are being implemented effectively. So that's sort of where the evaluation people come in. Larry does a lot of this work as well. But also that if people receive the information, so let's say that through my social media project, I am disseminating information, in my case, about cardiovascular disease and stroke. And so is it enough for people to get the information to see it? Or are they actually understanding the information that they're seeing and effectively changing their behavior? So this is where Robin comes in, right? And all of her field for behavior change. And so it's really when you start to think about the process, it really is team science that's necessary in order to be able to go across the spectrum, right? From like discovery to implementation to dissemination to evaluation to ensuring that there's knowledge transfer and knowledge acceptance and uptake in the populations for which you are trying to target the information. So to date, there has been a lot of inconsistent terminology and naming, but also defining implementation dissemination strategies, specifically dissemination strategies, because it's so underdeveloped. There's a lack of agreed taxonomy. There are lots of variations in how the strategies are operationalized. So who is targeted, who delivers it, who receives it, the temporality of the information as well. On social media, we're talking about like seconds. Have you ever been on Instagram or TikTok or Facebook, maybe even LinkedIn, right? Like with LinkedIn, the emails come in my inbox. I glance at it briefly, and because I'm not an active user, you know, it may make an impression on me. I'm not sure, but that's sort of what we're trying to get at as well, right? Is understanding on the user end exactly how information is reaching people, and so this figure comes from Titler and others from 2016, social isolation and loneliness in older adults, opportunities for the healthcare system. I really loved the figure because it talks about the way in which you can use communication to increase the rate and extent of adoption of information and strategies. And so it's a great way to sort of think about, in the context of the work that you're doing, ways in which you can get at the end user, understand the social system such that you're increasing the uptake and knowledge transfer of the information or strategies that you're trying to convey. So some food for thought for designing an effective implementation, well, really a dissemination social media strategy is what I'm focused on here, is to understand how complex your topic is. And are you disseminating one single idea or is it multiple things at one time? In my case, I'm talking about cardiovascular and cerebrovascular disease broadly. The intent there is to share information that can prevent heart disease, strokes, heart attacks, you know, all of the things that fall into those two big buckets. And so I'm really dealing with a vast number of topics that can fall under those two broad categories. have you considered the knowledge of the end users or recipients? So we tend to forget, if you're dealing with general or lay audience, general population or lay audiences, that not only are there different learning styles, some people are more auditory, some people are more visual, some people are, just so skilled at reading comprehension, but that on average, what we're writing for when we're disseminating on a broad scale, let's say like nationally, is really like a 4th to 6th grade reading level. And that paired with that 4th to 6th grade reading level, you need to think about these other learning styles of the target populations you're trying to reach. And so if you have to not only create written or text messaging, that you also may miss out on the entire population that has more affinity to audio or visual learning styles, for which videos or graphics might be a better way to reach those people. The other thing that we tend to forget with communication is that, especially if you're doing something on social media, you want alt text in your images so that it's easier for people to be able to also access that information. What I've learned through my time on social media is that a lot of people also either are on Facebook, TikTok, all of the social media platforms with the volume off. They're watching social media or looking at social media either on the job or while breastfeeding or at nighttime when you don't want to disrupt a partner, for example, in bed, and that the volume is off. And so if you have text that is really small and you don't have any audio that's attached, or it's just an image, but all of the text is in the caption and people are just scrolling, that you need to think about the ways in which you're designing that information such that it is targeting all of the senses at once, not smell, hopefully, but but everything else. And so also important is to think about how whether you've considered the knowledge of the end users or recipients, right? Like, how much do you know? We know a lot about the topics that we're talking about, and we tend to forget that people have zero to little knowledge about what it is that we're talking about. We make a lot of assumptions about what people already know. And so I think it's really important to go back and simply like break the information down. I've started to go to my 8 and 12-year-olds and say, does this make sense to you? Do you know what this is talking about? Right? So I've got a 2nd grader and a 6th grader that's right in the range of the national reading levels that I'm supposed to be targeting. And so it's really useful to say, hey, is this message clear? And what is this message saying to you? And so it's one easy way in which you can test the information that you're putting out, if social media is the platform that you're planning to use in order to disseminate that. Defining the context in which the tools you plan to disseminate will be used, define how the tools will be used and designed, and then how primed are you to use the tools and strategies for social media dissemination. If you are not skilled in social media, this is where really partnering with someone or some people is going to be really important in order to be able to effectively use these platforms so that you can communicate what you need to communicate to your audience. So this is a great paper that if you need sort of a step-by-step we're trying to do this, Larry's trying to do this for implementation science. If you need one for dissemination science, this is a great paper that will get you through the thinking process for which you need to adapt not only the framework but the strategies in order to be able to effectively disseminate the information or strategies that you've developed in your intervention. It really tells you about not only, if you go back, the strategies that you may want to consider. These are all questions, so it's like not checkboxes necessarily, but it helps you think critically about how it is that you're going to design that dissemination strategy. What is the research that you're doing? What does that research user relationship look like? and really gets at the idea that you will be able to define your target audience and or the stakeholders for which the information that you're planning to use will be effective in the context in which you're planning to present it in. And that if you need to, for example, just like we have in implementation science, need champions to be able to also help you with the dissemination of your strategies or information, that you establish ways in which you can interact with them so that you liaise effectively between the work that you're trying to do, the work that's going to be disseminated and or the strategies, and those that are going to be on the receiving end. Additionally, and really important, I think, is to understand what is the gap. What are the baseline or current practice indicators prior to this practice or information change? Will you engage with the disseminators in discussions about the current practice or the formulation of strategies so that you can be in alignment with what you're trying to promote and what will be effectively disseminated? In the case of social media, will you adapt your process, your current practice and formulation strategy so that you can align and make sure that the dissemination is effective for, let's say, you know, your strategy is going to be different if you're on LinkedIn because your audience is going to be different. LinkedIn may be more of a professional setting, whereas if you're on social media, you're going to have different age ranges. Depending on the content, you may attract different genders, for example. So you really need to think about who the audience is going to be so that you can address that gap. Will you have plans for ongoing auditing and performance indicators? So as you're disseminating, what is going to define an effective dissemination strategy, right? Is it, if you're thinking about like hospital systems, for example, and you're disseminating an intervention that worked really well at your center, and now your plan is to disseminate to 5 other hospitals or healthcare systems, will you define success if one hospital system was able to implement and adapt, or is it that success is going to be defined if all adapt? It's an all or nothing approach. If you're talking about dissemination of information, what is your threshold, right? How many people are you aiming to reach, and how many people have to engage in order for you to define that your dissemination strategy was successful? Aggregate the data into reports. Get weekly, monthly reports and understand what data you want to collect. And then really have conversations with the people that are your champions or stakeholders on a regular basis so that you can be iterative in your process for disseminating that information. So really important also to have a trial period where you are able to test the dissemination and be able to have an opportunity to get feedback so that you can modify as necessary. Track the process of the dissemination. So because there are no gold standards at this time, it's really important for you to think about all of the different steps. If you've ever worked in a lab, you know that you keep a lab journal and you document every step of the process, exactly how many, micrograms you used and at what time the experiment was conducted. These are all data that you need to collect so that you can go back and evaluate. Yes, this worked. No, this did not work. And this is the context in which this did or did not work, so that you can later provide guidance to your team and or other people who are also trying to adapt the same dissemination strategy that you use, and you can address questions that may come up later. It'll help you solve ongoing or future challenges, and then you can really share the implementation of the dissemination strategy that you used that really worked. So I think that it's also important to think about the stages at which you are in your implementation work and see and make sure that it's primed for dissemination. I think too often we are a little eager to disseminate when our strategies or information isn't quite ready for prime time. So make sure that that implementation phase is at a point where it can be disseminated and you don't necessarily need to go back and de-implement, right? This happened a little bit with the COVID-19 pandemic in some aspects of what we very quickly implemented that needed to go back and de-implement. We had awful dissemination of information during this pandemic. I think that is one example that we can use to really as a case study for understanding how best to disseminate information, and who the targeted audience are, the nature of the information that needs to be communicated, and what is the desired outcome, right? So really think through what is it that I want to accomplish after all of this is disseminated. So social media feels a little scary for some people. I get that. And we also think of social media in a very fun and playful way. We think of, like, the TikTok dances, and we think of like Instagram pictures of people on, flamingos in a pool with a drink. And so I think that we have developed this very, like, party social view of some of these platforms, and that they also tend to trend younger. But I think that, especially if you're in public health, that's why it's so important to think about social media, right? Like, go to the people. You need to go to where they are actively engaged in the receipt of information. In many ways, this is also community-based participatory research, but it's digital. It's on an online community. For professional networking, you have a number of groups as well that you can target. LinkedIn, which I'm not an active user of, but a lot of people tend to really like it. It's a great way to disseminate your findings as well. So we tend to think about dissemination, I think, as sort of this big bucket where, like, everything falls in, and it can either be dissemination, as we talked about, of the strategies that you've implemented. It can be about information generally about your topic. Let's say, you're doing dementia, or you're doing HIV PrEP information, whatever it may be. I think that too often we think very generally about what dissemination can mean for those topics. But it can also mean a way in which you can find collaborators, in which you can find champions, in which you can connect and build networks with people that can help you further disseminate beyond the scope for which you had originally planned. Twitter is another great place for this, right? At one point, I think the data had shown that a paper that was published and shared on Twitter was cited 7 times more than a paper that sat on PubMed. And so what is the purpose of our work if it is not being read? So it feels a little bit self-serving to promote our work, but we're in the business of saving public lives, right? And so we should be disseminating this information as broadly as possible so that it reaches the most people, and we can effectively change and move that public health needle. So I think really important to think about that. Ways in which you can share media, videos, images, or also have conversations with people, go live, are places like Facebook, YouTube, Flickr, Instagram, TikTok. Vivo is used on occasion as well, where you want, like, more internal groups where you just want your content shared with a specific group of people. Like if you have community groups that you have in 2 different arms of your intervention, maybe you want a Vivo account for just one group and then a different Vivo account for the other group, and they can be receiving different video information on either of those platforms. So when using social media and mass media, you want to think about the messaging, what the audience knows, who the customer or patient or population is, frame the messages accordingly, and then be really intentional about how you choose those communication channels. Bronson and others have done a lot of work in this space, and I think it's really important to think about that as you plan for that dissemination strategy so that you can really frame the messages accordingly and identify the proper communication and or social media platforms to reach them. So I took all of this, let's see, I wrote my grant in 2020, right at the start of the pandemic. I took all of this information and I said, I have been an active user of Instagram for many years, probably dating back as far as 2013. I knew that there was a really active, engaged audience there. I knew the power of the influencer existed, because an influencer could put up a bottle of hand cream and 1,000 people would buy it in the matter of like 10 minutes. And so there's power in influencing that could be leveraged for good, right? That could be leveraged for health information. And so I propose to the American Heart Association that we create a heart health information awareness campaign. And what was born of that was this ability to really bridge that gap between discovery of public health, education, and engagement for lay audiences, and really work on that ineffective dissemination of information that exists. And this is particularly true of evidence-based information. We are living actively in the midst of a mis and disinformation period. And it's crucial that our voices who are sharing evidence and fact-based information be present to combat all of the crazy stuff that's out there, so that you can really put into the social media and digital world all of the information that people should be trusting and really acting upon. And so it's estimated that at least 72% or more of the population uses social media. I thought then, Instagram and Facebook would be primed for this type of work, specifically to disseminate evidence-based CVD and stroke information. The American Press Institute reported that 96% of millennials use Facebook, Instagram, or Twitter and check the platform at least once a day. 44% reporting they check these platforms multiple times a day. I can attest that I on not so busy days also do this. And millennials are defined as those who were born between 1981 and 1996, currently aged 23 to 38 years of age. Well, this has changed a little bit now, since I wrote the sentence, actually. And that millennial women, especially because the goal is to increase awareness and education among millennial women, specifically because women are underrepresented in cardiovascular disease and stroke research. They are underinformed about what it means to have a heart attack and stroke. There are severe disparities with respect to race, ethnicity within women, or persons who identify as women. And so that it's really important to be able to educate so that we can create prevention of these outcomes in this population. So it's timely to be able to target this population. And so I hypothesized that social media would be an ideal way in which we could disseminate information, but also recruit women into our study. So this is the Millennial Women's Heart Health Study that is funded by the American Heart Association. It's a 2-year grant, preventing CVD and stroke among millennial women. And the idea was to be able to address the disparities that we have identified in this population. So back in 2017, I co-authored along with Chris Shea this inequality report, which really it's a deep dive into the literature with respect to the disparities that exist in cardiovascular disease in women, and that although we've made some strides in the field, it really has not reached the place where we have closed the gap on disparities, and that actually we've sort of regressed in terms of making progress for women in cardiovascular disease and stroke. And so that targeting millennial women would be a critical population to focus on so that we can start to infuse the information and hopefully create some lifestyle and behavior changes that allow them to use the information to make healthier choices and be able to at least be aware, not only to prevent disease in themselves, but then be able to help the older generation that they're sandwiched between, to also prevent, but also perhaps treat and ameliorate existing disease. So I talked about teen science earlier. The idea here was to really partner with people who know things that I don't know. And so Dr. Olivia Fuso is an associate professor also at UAB. She has studied nutrition and obesity and physical activity for years. Her target population has been African American women. And so in order to be able to address specifically underrepresented race ethnic women in our messaging, I wanted to bring Olivia on. I've done a lot of work in Latinx, and so between the two of us, we could target Black and Latinx women who are millennials nationally using this social media campaign. And I am an avid user, as I mentioned. However, I don't know the ins and outs of social media. So I partner with Alex Krallman, who used to be at UAB, but is now at UNCW. And she does this for brands like Coca-Cola and other big places, social media marketing strategies and digital marketing and recruitment. And so together we were able to put together this grant that went into the American Heart Association, and the American Heart Association loved it, really thought they would be a great way to increase knowledge transfer in the populations that we were trying to reach. And really, because the materials already exist through the American Heart Association, and that we were creating new ones as well, that were educational materials to share on social media, that we would be able to really create this wonderful toolkit of social media shares that would create awareness and education. So here's an example of work that I was doing prior to getting funded by the American Heart Association. This is me. I am no longer chic in academia. This refers to a little bit of branding. So I started my Instagram account sharing strictly sartorial information, how to dress for your job interview, how to get a $2 suit at the thrift store so that you can dress professionally on a graduate school budget. So this is sort of where I started. But what happened is that I gained the trust of the people who were following me on social media over time, so that when I made the pivot and rebranded to Dr. Bertha Hidalgo and started to share information about COVID and why we don't take antibiotics for viral infections and why it's important to get your HPV vaccine, people were really receptive to the information. And what our research has now shown as well is that you don't have to be an expert in the field in order to be a trusted voice on social media platforms. And so when you're thinking about those champions that are going to help you disseminate, it's not necessarily going to be one of us on the Zoom call, right? It may be someone who has zero knowledge that you need to train up, much like we do with community health advisors, right? Or like lay health educators, that you need to find the people who are trusted on digital communities so that you can share evidence-based information with them and they can be the champions and disseminators of the information. In my case, I served both roles. But was able to pitch to the AHA that we would share on Instagram, Facebook, we would share our findings on Twitter, we would create YouTube videos so that we were explaining the science behind cardiovascular disease and stroke. And then Pinterest offers a great opportunity to create graphics that can be easily pinned. They take a lot of real estate on your web browser or on your phone. And it's a great way that as people are scrolling, you can capture their attention for longer and be able to, without many words, be able to share a visual of the work that you're doing. So I created a series called Science Says Sunday on Instagram, where every Sunday I share a science find. It became more frequent during the COVID intense years, 2020 and 2021. It's reverted back to mostly Sundays, but I shared information in English and Spanish. And what grew out of my ability to network in the fashion world for some years was that I was connected to other really big influencers in spaces that were not science-based. And so these are some of the influencers here that have that I've connected with and networked and who agreed to come on and also share our content. So Dulce has 1 million followers on Instagram, over 2 million on YouTube. Laura Scott is now up to 300,000 on Instagram. And so the idea here was to leverage people that would have separate independent networks that could share the information so that your network has these fingers that extend far beyond where you originally sit. We also partnered with We All Grow Latina and Black Girls Run. Black Girls Run has featured our information and our calls to action for participation in the American Heart Association cohort on their monthly newsletter. They are single action posts where it's just something that is included on the newsletter that people may or may not interact with, but it's about testing also how willing people are to click on the post within the newsletter, then go to the landing page for our recruitment site, and then actively consent and enroll and fill out our survey. So we're learning a lot from this process of engaging influencers and networks. But the idea was really to create this like wide web, right, of people that could be champions and disseminators of the information, to be able to create a place where people trusted the information that was being shared by the influencers and networks, and then be able to be willing to participate in our study. So the study is the Project Baseline Registry. The American Heart Association is building this large cohort of women that will be able to be exposed to a number of research opportunities. So it's this big like research community that they're building of lay populations. And we estimated that through our networks and influencers, we would be able to reach over 4 million women, of which if only 10% engaged and only 10% of the 10% actually enrolled in our study, we could recruit 2,000 women into the Research Goes Red Project Baseline cohort. So we are on our way to achieve that. We've created swipe up features so that anytime we share information, you can either swipe up to the American Heart Research Goes Red page, or on our specific calls to action where we're actively engaging women to be recruited into the study, we link to the landing page where they can get more information about that. And then for AIM-3, we really wanted to be able to evaluate all the information that we were collecting. So we're using monthly analytic reports to measure awareness, conversions, who the audience is, using Google Analytics to help us track. So if I share a post on Instagram, I'm able to know not only the time it took from when they saw the post to when they landed on the landing page, and if they consented and enrolled and fill out the survey. So on average, someone who completes that process does it in 6 to 10 minutes. So from the time they saw something on Instagram to the time they're done with the survey that we put on the Project Baseline Registry, it's maximum 10 minutes, right? So this is a consequence of understanding that we needed to write everything at a 4th to 6th grade reading level, make things super simple for people to access, and be able to build the trust. We spent a whole year building trust with our community, sharing just information, not asking anything of them. So then we could ask for the ask, right, which was participate in our study. And so, again, this is a 2-year grant. I'm sharing this because I think if you're planning to design a component or an aim in your grant related to this, that you have an understanding of like how much time and budget, etc. So we did request money for influencers and networks so that we could pay them for the time. They're content creators, and so they get paid on time they spent on creating content, effort coverage for us so that we could oversee and also create content and be engaged on social media. And then we ultimately did not offer participant incentives. So this was a really interesting part of this study, is that the American Heart Association, because they are a not-for-profit, really wanted to test through our study also the benevolence of like people's willingness to participate in research out of like the goodness of their heart, or because they want to give back to the community. And so we are not paying participants to do this. We put the information out there and we say, if you are called to, for example, participate in research, if this is important to you, to your community, if you want to help me, we're testing all of this messaging. If you want to help me as an investigator, would you be willing to participate? And it's been really interesting to see how that has turned out without offering any participant incentives. And And the goals obviously were to educate, raise awareness about CVD and stroke, engage women in the process. So even if they don't enroll in our study, we have done our job, right? We've given back, we've educated, we've raised awareness, we're going to measure how knowledge transfer has happened. And then if they participate in the study, it's going to be an added benefit. And ultimately, of course, bottom line, to prevent cardiovascular disease and stroke. Okay, so a lot of this work was catapulted, at least the importance of it, because of COVID-19. There were just so much overlap between cardiovascular disease, not only comorbidities, but also we now know outcomes as a result of infection with SARS-CoV-2 virus and or having had COVID, that it really has helped us with the types of shares that we've been able to disseminate. So it's ranged from like Darth Vader. I shared this one on May 4th yesterday. So Darth Vader's theme song has a tempo of 103 beats per minute, the perfect pace for performing chest compressions and CPR. May the 4th be with you. And so it's about being timely, thinking about the context, understanding your audience, and then creating really graphic but also descriptive shares like this one on the right, where we tell women about what they'll get if they participate in the study, if they join the registry, the importance of joining the study. For example, this one on the right here is, I want to help you contribute to research about heart disease in women. So this was a message where we were testing, in marketing, they call it A/B testing. So you have similar messages, but the phrasing is a little bit different. In this case, it was like, help me help you participate in research so that you can gain more knowledge and experience. Other messages were, let me help you, be able to do this, or help you and your community be able to participate in research so that like research findings apply to you. Then we're testing fear-based versus like prevention promotion messages. So this is an example on the left of a fear-based message. More than 40% of Hispanic women over the age of 20 have cardiovascular disease. And what you can see is that there were responses, and just as we anticipated, that this fear, what we intended to be a fear-based message, resulted in fear-based responses. So up at the top, you can see, oh my, I would never have guessed it'd be so high, so scary. This is a very scary statistic. Wow, right? And so we're testing the type of messaging that is put out there. But we also, what's been really great about this is that have gotten some really great messages from the women on the posts. This is great. I'm never going to forget this. In response to the May 4th, RPM songs that you can use to remember CPR chest compressions. When talking about physical activity, for example, that walking 10 minutes a day makes a big difference. Thanks for these great tips. Small goals equal big changes. When talking about the calls to action, I will be signing up as I felt called to participate in medical research over the last several months, right? So maybe there are people who are primed. We talk about, the laggards and the, Robin, help me here, the people who are like ready to go as soon as they hear about something, right?
Early adopters.
Yeah, early adopters. Thank you. Yes. And so that at any given time, you have people that are ready to receive the information and take action, and that your post may be just the thing that they need in order to do that. In summary of the year of posts that I was sharing, I got this private message that said, thanks to your heart health messaging, I didn't ignore the 2 Apple Watch notifications I got. I've had the watch for over 8 years and never had an alert, then got 2 in one day. Was diagnosed with congenital WPW, and in prelim tests today say they got it, and once they verify in June, hopefully I will be cured. Thank you for your heart health messaging. So you're making a difference with the dissemination of the information that you have, right? We sort of like keep this information in our pockets and we share it with our academic circles, our professional circles, and then it sort of stops there. We rely on like journalists and other people to put this information out there, and it's not always correct. And so as I encourage you to think about, you're all implementers of these strategies and projects, and that you really think actively about ways in which you can disseminate the information to the people that very much need the information in the first place. Okay, so we're running out of time. I want to allow time for questions, but these are the results that we have so far. So less than 10 actions. So each action that we put on social media has to be IRB approved, right? So we can't just like share, like the May 4th, for example, is just information that can go out on social media, but anything that requires that people go to the landing page, consent and enroll needs to be IRB approved in advance. And so in less than 10 actions, so one post on social media, one post on Facebook, you know, the rest on newsletters or on different social media. Dr. Afusa also shares Black Girls Run shared on their newsletter twice. So in those individual actions, we were able to recruit 120 women who were not paid to do this. And of those, 109 filled out our questionnaire. So that's just 10 individual, like, reach out passively to people, and we were able to get this response. So now we're in the midst of doing a hard push between now and July, where the influencers are going to be pushing content. We're going to be pushing content almost on a daily basis. We're going to test reels on Instagram, also engage some TikTok influencers where most of the people are currently engaging, to be able to assess all of this. But what we see is that people are using this information so well. Oh, Robin, do I need to answer a question?
Sorry, I didn't mean to alert you that much. I was just trying to let you know that there were questions, and
Okay.
definitely wanted to save time for it. Sorry, I didn't mean to startle you.
Instagram has this great feature where it shows you how many people have saved the post for later. Like they want to come back and read the post. 70 people shared this post on stories or to their friends via private message. And so even when you don't get a lot of comments, right? Like, and think about like really sensitive topics that you may be dealing with when you're putting on social media. I want to encourage you not to be discouraged by the lack of like seen interactions, right? Because I think that it's really important to know what's sort of happening behind the scenes. And so this one post alone that was shared yesterday reached 5,000 accounts. You know how quickly people scroll, right? And so so even just with this passive sharing, over 5,000 people saw it. But what's really great is that, oh, did it not save on here? Here it is. In the last 90 days, we've had over 1 million impressions. We've reached over 250 individual accounts that actively saw the information. So these aren't like bots or like, you know, accounts that nobody owns. And we've had a lot of profile activity, and we are reaching that target millennial age population that we were hoping to. Another impression sort of information showed that like 96 or 97% of my population, I think it's 93 actually, is all female. So also the intended target audience. I think that's all I have. These are just like, I can share my slides, but these are just, you know, reminders that you want to think about before you disseminate. So set SMART goals, develop a strategy, listen to online conversations, talk to the people that you're hoping to reach through social media, really participate and become a resource. People are out on social media to gain information, gain a service, like they want to learn something. And so build that online personality or use existing online personalities to be able to disseminate your information effectively. Okay, I'm gonna stop. With that, I will close and open for questions.
Thank you so much, Bertha. That was amazing. A master lecture again. And don't get overwhelmed by the chatter. You are doing just what you do, engage and get people to talk. So as maybe I can summarize a little bit, but one of the things is just looking at ways to sort of increase followers, making sure that they get it, whether you pay for it or not. And then kind of monitoring it and how to boost it and make sure the trolls and all of that.
Okay, those are great questions. So I would say that we also have tested boosting on Instagram and Facebook and found that our organic passive posts worked better than the boosting or the ads. Um, what we found with the ads was that yes, it was more targeted towards the population that we defined, because you define in your ad who you want it to go out to, you know, the whole nation within this age range, these particular people. But it tended to perform less well than the information that was broadly available to everyone, and I think it's because the ability to share is readily available for posts that are not targeted to the individual. And so there is more of an opportunity for me, for example, to share this with like my mom and my aunt and like my cousins and all these other people. And if I were the target population, it may only come to me. I might not think that it's relevant to anybody else and be less likely to share. But the proportion of accounts that were reached with a Facebook ad or boost were far lower. It was 7% versus the 60 to 70% that we were reaching with the organic or passive posts. And so I would say, at least in our campaign and our study, those were not effective. Hashtags, I see, yes, from Michelle, they can be effective as well. Tagging other people or accounts is a great way to get others to see it. But also, if you have an established dissemination strategy where you say, these are the people that we have reached out to in advance that have agreed to share our content, right? So like you can reach out to me and say, hey, I really need help with this study. Do you mind sharing on your Instagram platform? And it can feel organic because it's not a direct ask that happened on social media, for example. That's just another way to get your information out. Understand the times at which your content is being viewed. And I did see a question about like increasing the likelihood that followers will see the posts and videos. I think that's about understanding your audience, right? And understanding that engagement and likes and follows may not necessarily mean that the people that you're intending the information for are not getting it. It could just mean that they don't want to be seen, right? And so that it's still getting out there. They're just not liking and or following. Let's see.
Have you used Twitter chat much?
I have not, but Twitter chat is another great place. I think this is again about how you've purposed your social media platforms. I've purposed mine mostly to be centered around professional networks. And so I don't have a lot of lay followers on Twitter, nor do I engage with a lot of lay individuals, unless like they were really interested in COVID information I was sharing. And so it's about understanding sort of who is out there and who you can attract.
Michelle has a nice comment. Michelle, if you'd like to unmute, I welcome you to do so. Otherwise, I'm happy to read what you wrote.
Hi, which comment was it?
About the your tactic for creating a flyer.
Yeah, so our group, I work for the Cobra on opioids and overdose at Rhode Island Hospital, and we hosted our first Twitter chat last year on housing and overdose. And so what we did is we created a flyer beforehand and we sent it out to our mailing lists, and we invited specific people to engage during that hour. And we had our account was moderating it, and we also had two academics facilitating the conversation. So in the end, it ended up being an hour of like a lot of different academics and researchers participating, and we got a lot of followers from that organically and retweets and things. So I think it can be really beneficial.
Yeah. That's a great point. Facebook Lives are similar to the Twitter chat spaces, and so I've done Facebook Lives on COVID, for example, with influencers who were like, their focus or topic is parenting. In this one case, it was a dad who like talks about how he parents as a dad, but has millions of followers because of the content that he shares. And so we did a Facebook Live, and he asked me questions about COVID and why like vaccination was important, and why the stay at home was important, and why masking was important, and that went really well. And what's great about those two is that it lives permanently, or can live permanently, on Facebook, so people can go back and watch. There's a little bit of like narcissism that happens on social media with follower counts and likes, and so I really want to steer the group away that if you're planning to use or create your own social media accounts, either for your study or personally, that not be the driver or guiding force, that you really think about the impact and the information that is being shared. You can always liaise or partner or collaborate with other people that have really large followings, but I've been very intentional, to Lauren's point, about curating an audience that is respectful, that is there to receive the information that is needed. I have no problems blocking, deleting comments, giving warnings. And so, for me, my audience is at like 35,000. That's where I plan to keep it. But it is a very like engaged, respectful, just trusted community that I think you can curate. And so bigger isn't always better.
Awesome. Thank you. And another question in the chat from John is, how much time do you suggest spending on various platforms? How much time does it take someone to become proficient on a platform?
Yeah. So this again gets back to the question of the purpose of the platform. So is the purpose of the platform to convey information and or disseminate information about your study or project? If so, then I highly encourage that you think about like a social media intern or someone that you're paying to actively monitor all of these platforms. The number of platforms is going to depend on who your intended audience is and where they like to stand by the water, a social water cooler. And so if TikTok's the one place, then maybe you need to go to TikTok, or if Facebook is the place, then you need to go to Facebook, or if they're all on the places, then you can decide that. For me, it's not a lot of time per week. And because I became busier over time, I started in 2013, my one post that people know to expect is Sundays at 6 p.m. around. And they know they can come to my account every Sunday and find the information they need.
Awesome. Well, thank you so much, Dr. Hidalgo. This was amazing and excited to share with everyone. And we will upload the recording along with her presentation slides. So thank you again.
Yes, thank you all so much.